Hello and welcome to my YouTube channel, AnatomyMentor. Today I'll be revising the brachial plexus. Now this is a very important topic of gross anatomy, and as you all know that the keystone of the anatomy of the upper limb is the brachial plexus. This is an important plexus or network of nerves which is going to supply the upper limb. And so today we are going to be covering the essentials or the basics of the brachial plexus. So our learning objectives for today are that we should be able to understand the supply of the upper limb through the brachial plexus, and we should also understand the formation, the basic parts, the major minor branches of the brachial plexus, and also we'll be discussing a few nerve injuries which are related to the brachial plexus specifically. So today let's start with this important topic. The brachial plexus, as I told you, is a network of nerve fibers that begins in the root of the neck and then it passes through the axilla to enter the upper extremity. And it is formed by the anterior primary rami of the fifth cervical to the first thoracic spinal nerves. And it is supplying the skin as well as musculature of the upper limb. Now here we can look at the brachial plexus. If you follow the laser pointer, this area in yellow, this bunch of nerves is representing the brachial plexus, and you can see it emerges from between these two muscles that are the scalenus anterior and medius. And then this brachial plexus, it is going to pass behind the clavicle or collarbone, which has been partially removed over here to show you the brachial plexus, which is then entering the axilla. The axilla is the cone-shaped region or pyramidal space, you could say, in the armpit. And from there, the branches, then they're going to enter into the upper arm. Now, this is a hemisection of the spinal cord, which is showing us the formation of the spinal nerves. You can see over here that there is a posterior root and there is an anterior root, which then unite to form the spinal nerve within the intervertebral foramen, and immediately the spinal nerve will bifurcate into an anterior branch and a posterior branch. The anterior branch, also known as the ramus, these are the ones which are going to form the brachial plexus. Which ones specifically? That is the fifth cervical to the first thoracic spinal nerve. Now, if we want to keep in mind the parts of the brachial plexus, we have a mnemonic, and this is the mnemonic: Ruhail Tivana drinks cold beverage. Now, you can replace the name by Robert Taylor or whatsoever makes you easily remember. We can see the first letter of each word in this sentence represents the parts of the brachial plexus. So R is for the roots, T is for the trunks, then D is for the divisions, C is for the cords, and the last letter, which is B, is for the branches. These are the parts of the brachial plexus in sequence. Now, the roots, as I showed you, they're in the base of the neck, deep to the scalenus anterior muscle. Then come the trunks of the brachial plexus. They're located in the posterior triangle of the neck between the scaleni anterior and medius muscles. Then come the divisions, which are lying behind the clavicle. The cords, these are the parts of the brachial plexus which are within the axilla, and the branches, they will enter the upper limb. Now here is a diagrammatic representation of the brachial plexus, and over here, if you look at this area, let's look at the origin of the brachial plexus. The roots of the brachial plexus, I told you, are the fifth cervical to the first thoracic spinal nerves. To be more specific, it's their anterior rami. Now, the fifth cervical, you can see this is exiting over here from the vertebral column above the fifth cervical vertebra. Now, this is the rule of exit, that each spinal nerve is going to exit above its corresponding vertebra. So C5 is exiting above the fifth cervical vertebra, C6 is exiting above the sixth cervical vertebra, C7 is exiting above seventh cervical vertebra. Now, in case of C8, there is an exception, as it is going to exit between the seventh cervical vertebra and the first thoracic vertebra. This is because there is no eighth cervical vertebra. So as these anterior rami of spinal nerves are exiting the vertebral column, we can see that these roots are now going to lead to the second part of the brachial plexus, which are the trunks. And there are three trunks, which are upper, middle, and lower. And then those trunks, they divide. You get the divisions of the brachial plexus. The divisions, they lie behind this bone, which is the clavicle. And then come the cords of the brachial plexus. The cords are the ones which are placed within the axilla of this region. And then emerge the branches, which are the major branches. The major branches of brachial plexus, they are going to enter, you can see over here, the upper arm. Also, I want you to notice that the subclavian artery, it is closely associated with the brachial plexus, and this subclavian artery then continues as the axillary artery within the axilla. And this axillary artery, you can see over here, it is in close relation to the cords of the brachial plexus. And also over here, you can see that the pectoralis muscle, the pectoralis minor, has been removed to visualize the brachial plexus. So keep in mind that the cords of the brachial plexus, they are named according to their relationship with the second part of the axillary artery. Now, this is a simple diagram. We've removed the muscles, majority of the surrounding structures, just to focus on the brachial plexus and its specific branches and its relation to the axillary artery. So let's look at the origin first, the root of the brachial plexus. The roots are 5th cervical, 6th, 7th, 8th cervical, and then the first thoracic spinal nerves, C5 to T1. These are the roots of the brachial plexus, the anterior rami of the 5th cervical to 1st thoracic spinal nerves. Now over here you can see that the 5th and 6th roots, they are going to unite to form this upper or superior trunk of brachial plexus. Whereas you can see the 7th, it is continuing as the middle trunk, whereas C8 and T1 will unite to form the lower or inferior trunk of the brachial plexus. So this is the region of the trunks of the brachial plexus. Now each trunk is going to divide into two divisions, which are anterior and posterior. So this area is the area where the divisions are present, and you can see that the anterior divisions of the upper and middle trunks are going to come together and they will form this here cord, which is the lateral cord of the brachial plexus. Whereas the posterior divisions of all three trunks will unite to form the posterior cord of brachial plexus, and the anterior division of the lower trunk is going to simply form the, you can see, the medial cord of the brachial plexus. So eventually the three cords, lateral, posterior, and medial cord, they are lying over here in close relation to this axillary artery, and their name is according to their position in relation to the axillary artery. So this lateral cord is lying lateral to this axillary artery. Here is the medial cord. You can see it is lying medial to the axillary artery, and the posterior cord will be behind it. Also keep in mind, this is the pectoralis minor muscle, which is lying anteriorly or superficially to these cords and axillary artery. Also, you can see over here comes the next part of the brachial plexus, which is the major branches of the cords. If you look at the major branches are the musculocutaneous nerve, the median nerve, the radial nerve, and the ulnar nerve, and also the axillary nerve. Now we are going to go to the next diagram, and we're going to look at these nerves, the branches, in much more detail. So this is a schematic diagram. This is the sort of one which I would recommend that you should be able to draw it on a copy with your pencil in just less than 2 minutes. If this is the one which is right there in your mind and you can reproduce it at any time, then you will never forget the origin, the formation, and the major branches of the brachial plexus. And this is one which is quite easy and simple to draw. You can see here are the 5 basic parts of the brachial plexus mentioned at the top: roots, trunks, divisions, cords, and branches. And do you remember the mnemonic I told you to remember these parts? That was Ruhel, Tivana, drinks, cold, beverages. So this was the mnemonic for remembering the parts of the brachial plexus. Now let's look at the roots. The roots are the anterior rami of C5, 6, 7, C8, and T1. That is 5th cervical to the 1st thoracic spinal nerves. And like I told you, C5 and 6 are going to come together to form the upper or superior trunk. C7 will continue as the middle trunk. C8 and T1 will unite to form the inferior or lower trunk. So these are the three trunks of the brachial plexus: upper, middle, and lower. And then comes part which are the divisions. Divisions, I told you, can be anterior or posterior. So you can see over here, the anterior divisions of superior and middle trunks will unite to form the lateral cord of brachial plexus, whereas posterior divisions of all three trunks will unite to form the posterior cord of the brachial plexus. You can see anterior division of inferior trunk will continue as the medial cord of the brachial plexus. So here are now the three cords of the brachial plexus. These cords are now going to give rise to the major branches of the brachial plexus. These major branches are 5. Remember their names: musculocutaneous, axillary, median, radial, and ulnar. I'm also going to be telling you a mnemonic to remember the major branches of the brachial plexus. But first, I want to go through the location of these different parts of the brachial plexus. Let's revise again. The roots, they are present in the area which is the root of the neck. The trunks are present in the posterior triangle of the neck between the scalenus, medius, and anterior muscles. Then the divisions, they are located behind the clavicle. And then the cords. The cords are present in the axilla. And then come the branches, which are, you can see, entering the upper arm. So that is the location of the different parts of the brachial plexus. Another point that you have to remember is that the divisions do not give rise to any branches. This is the part of the brachial plexus, the divisions which don't give rise to any branch. The major branches are arising, you can see at the end, and these are the 5 ones over here. They're mentioned over here. Other than that, there are also some minor branches from the brachial plexus, and we are going to now look at those branches as well. So here you can see the minor branches from the roots. They are the dorsal scapular nerve, which arises from C5, and then the long thoracic nerve. Its origin is from C5, C6, and C7. So dorsal scapular nerve and the long thoracic nerve, these are the two minor branches which are arising from the region of the roots. Now let's come to the trunks. In case of the trunks, remember it is only the upper trunk which is going to give rise to two minor branches, and these are the suprascapular nerve and then the nerve to the subclavius. So these two are the ones arising from the upper trunk of the brachial plexus. The divisions, I told you, they don't give rise to any minor branches. Now let's come to the cords. The minor branches of brachial plexus which arise from the cord, they are the lateral pectoral nerve emerging from this here lateral cord. These three nerves arise from the posterior cord, which are upper subscapular, thoracodorsal, and lower subscapular. So these are the three arising from posterior cord. The medial cord of brachial plexus gives rise to these minor branches, which are medial pectoral nerve, medial cutaneous nerve of arm, and medial cutaneous nerve of forearm. These are the three minor branches which are arising from the medial cord of the brachial plexus. And this is the last part, which is showing you the major branches. I already told you about the major branches. Well, let's look at it again. You can see the musculocutaneous nerve, which is actually the continuation of the lateral cord of brachial plexus. And here is also the lateral root of the median nerve. The lateral root will form the median nerve. Then when we look at the posterior cord, it gives off these two branches, the axillary nerve and radial nerve. Remember, the radial nerve is actually the continuation of the posterior cord, and axillary nerve is its branch. Then looking at the medial cord, its branches, the major branches are the ulnar nerve and the medial root of the median nerve. So median nerve is formed by two roots, the lateral and the medial roots, which will then combine to form the median nerve. So eventually you've got the 5 major branches at the distal end of the brachial plexus. Now I'm going to give a short demonstration of the brachial plexus in relation to the upper limb on a 3-dimensional model, on a digital model, so we can understand the placement of these different parts of the brachial plexus and the arrangement of the branches and the nerves within the brachial plexus. Okay, so over here we have a three-dimensional digital model which is showing us the skeleton of the upper limb and the thoracic rib cage. And we can see the humerus bone, the bone of the arm, and the radius and ulna, which are the bones of the forearm and the hand bones. And here is the rib cage, and we are now going to discuss the brachial plexus. So I'm going to zoom in onto this region over here. You can see this plexus of nerves, which is the brachial plexus. It's the bunch of nerves which are present from the region which is the root of the neck, and they pass through the posterior triangle of the neck, behind this here clavicle bone, and eventually to enter the axilla, which is the cone-shaped pyramidal space in the region of the armpit, and then the branches from brachial plexus are going to enter the upper arm. So now let's look at the brachial plexus itself. Let's look at the branches in detail. Well, over here, I told you that the brachial plexus, it is basically formed from the roots. Over here, the roots, they are formed from the anterior rami of the fifth cervical to the first thoracic spinal nerves. So over here, you have C5, C6, C7, C8, and T1. So these are the anterior primary rami of the spinal nerves, which are going to form the brachial plexus, which is the bunch of nerves eventually going to be supplying the skin and musculature of the upper limb. So here, this area, which is in purple, represents the roots of the brachial plexus. And you can see that the fifth and sixth, they are going to unite to form the upper or superior trunk of brachial plexus. C7 will continue as the middle trunk, and C8 and T1, they are going to unite and form the lower or inferior trunk of the brachial plexus. So once you've got these three trunks, they are then going to be, the trunks are in green. They are going to then divide into the divisions. Each trunk will divide into an anterior and posterior division. And this area over here has been shown in, you can see yellow, this area, which are the divisions. I told you they are present behind the clavicle bone. This here is the clavicle bone. And these divisions, they are then going to give rise to the next part of brachial plexus, shown over here, the region in red, which are the cords. Now, the cords of the brachial plexus are very important. They are present in the axilla, and they are named according to the relation with the axillary artery. So you have the lateral cord, the posterior cord, and the medial cord. They're present in the axilla, and these cords will then give rise to, you can see this area in blue, which are the branches. They are the major branches arising from the cords are musculocutaneous, and you have axillary, radial, median, and ulnar. These are the major branches of the brachial plexus, which are then going to enter the upper arm. Other than this, there are also some minor branches. If we look at the initial parts, the region of the roots of the brachial plexus, we can see arising from C5 is the dorsal scapular nerve, and C5, 6, 7, they also unite. The branches from these nerves will unite to form the long thoracic nerve. These are the minor nerves. And then if we look over here at this part, which are the trunks, well, from the superior trunk, you also get the nerve to subclavius, and the also you can see the suprascapular nerve. And then let's look over here at this region of the cords. In the cords, you can see there are some additional branches other than the major branches that I mentioned going into the upper arm. From the lateral cord, you've got the lateral pectoral nerve. From the posterior cord, you've got upper and lower subscapular and thoracodorsal nerves. And also from the medial cord, you've got the medial cutaneous nerve of the arm, forearm, and the medial pectoral nerve. So these are the minor branches of the brachial plexus. So this was a short description of the brachial plexus, showing you the location of the brachial plexus in relation to the skeleton, in relation to the human body. And remember, this is a very important bunch of nerves which is going to be supplying the upper limb. Now we're going to go back to our PowerPoint slides. Okay, so let's summarize the branches of the brachial plexus. From the roots, we have the long thoracic nerve and the dorsal scapular nerve. The long thoracic nerve is going to supply the serratus anterior, and dorsal scapular nerve, it supplies the rhomboids. The trunks, I told you, it's only the upper trunk which gives off the suprascapular nerve and the nerve to subclavius. Suprascapular nerve supplies these two muscles, supraspinatus and infraspinatus. Now, what are the branches from the cords? Well, from the cords, we've got the lateral pectoral, musculocutaneous, and the lateral root of median nerve. These are the branches of the lateral cord of brachial plexus. Lateral pectoral nerve supplies pectoralis major muscle. Musculocutaneous nerve supplies these three muscles of the arm, which are coracobrachialis, brachialis, and biceps brachii. Also, it supplies sensory innervation to skin of the radial or outer aspect of the forearm. Then the posterior cord, I told you, is giving off these three minor branches. The upper and lower subscapular nerves are supplying subscapularis muscle, whereas thoracodorsal nerve, it supplies latissimus dorsi muscle. And then the axillary nerve, which is going to supply deltoid and teres minor muscles, and it is also sensory for the skin of the lateral side of the shoulder and the back of the arm. The medial cord is giving off medial pectoral nerve, which supplies pectoralis major and minor muscles, the cutaneous nerves of arm, forearm, ulnar, and medial root of median nerve. We already noticed that there are no branches from the divisions of brachial plexus. That's a point to remember. And I told you I'll be giving you a mnemonic to remember the major branches of the brachial plexus. So for that, you have this 5-letter word you keep in mind, which is M-A-R-M-U, marmu, M-A-R-M-U. M stands for musculocutaneous nerve, the A is for axillary nerve, R is for radial nerve, M is for median nerve, and U is for ulnar nerve. So this is the 5-letter word marmu, which will help you remember the major branches of the brachial plexus. And also, if you want to keep in mind the roots of these 5 major branches, then there's another mnemonic, that is the 3 musketeers assassinated 5 rats, 5 mice, and 2 unicorns. You might have heard of this one before. It just helps you remember the roots of the major branches of the brachial plexus. And this is how it's going to happen, is that you're going to label your roots on your fingers as C5, 6, 7, 8, C8, and T1, like so. And now, starting with the mnemonic, I said 3 musketeers. Well, 3 means now these first 3 fingers, the M is for the musculocutaneous, MU. So the root value of musculocutaneous nerve is C5, 6, and C7. Then when we say assassinated, we will then draw out a gun. Our fingers will be like a gun. So you can see in that case, you've got the first 2 fingers, C5, C6, which is the root value of A is for axillary nerve. Then the 5 rats are simply all 5 fingers. So C5, 6, 7, C8, and T1 are representing root value of R of rats is for radial nerve. And then the 5 mice. So then again, the 5 roots will be for M is for median nerve. But keep in mind, this can also be 4 mice because the 5th might or might not contribute to the root value of the median nerve. And then the 2 unicorns, here you've got the unicorn shape of the hand, and C8 and T1, these 2 fingers will be standing out. So C8, T1 are representing the root value of ulnar nerve. This is how you can remember the root value of these nerves. Okay, now let's come to the applied aspect of the brachial plexus, because we've talked about the anatomy, the normal placement of the different parts of the brachial plexus. Now, which parts are vulnerable to injury and what would be the consequences of that injury? Well, brachial plexus injuries are usually the result of blunt trauma, which produces nerve avulsion. And many months of dedicated rehabilitation are required for return of minor function. We're going to first talk about the injuries to the upper roots of brachial plexus, that is C5, C6. These injuries can result from spinal cord injuries in the cervical region. Also, the pulling injury or the stretch, which causes a hyperextension of the region of the neck. This can cause an injury to the roots of the brachial plexus, and this can occur, for example, in difficult vaginal delivery. And also it can occur if a person falls on the shoulder. The typical presentation is known as the erb's or erb'spalsy. In this case, the injuries to the upper root subbrachial plexus, like I told you, that is C5, C6, and there will be a characteristic position of the upper limb on the affected side. So in this case, you can see the affected limb, it is hanging by the side and it is medially rotated. The arm is medially rotated and it is adducted. The elbow is extended and the forearm, it is pronated and the wrist is slightly flexed. This position is known as the policeman's tip or the waiter's tip hand, also known as the porter's tip hand. And there is also sensory loss on the outer aspect of the arm, which is the region of C5. Now let's look at the pathophysiology of this condition. There is going to be a loss of function of the nerve to subclavius. If you recall, nerve to subclavius has its root value in C5 as it emerges from the upper trunk of brachial plexus. So this causes the clavicle to be depressed. And also there is a loss of function of these two nerves, the axillary nerve and suprascapular nerves, because they also contain the nerve fibers of C5, and the shoulder is adducted because of paralysis of abductors of the arm. Axillary nerve supplies the deltoid and suprascapular nerve supplies supraspinatus. Both are abductors of the arm. Since they're going to be paralyzed, that is why the arm will be adducted. Also, the arm will be rotated medially or internally. This is because of the paralysis of the lateral rotators, teres minor and infraspinatus. Then again, teres minor is supplied by axillary nerve and infraspinatus is supplied by suprascapular nerve, so they are paralyzed. Also, there is a loss of function of musculocutaneous nerve, which contains the C5 fibers. This nerve is supplying the flexors of the elbow joint, biceps brachii and brachialis, and since they are paralyzed, that is why the elbow joint is now extended. Also, the forearm is pronated because biceps brachii is also a strong supinator and has been paralyzed. Now let's talk about the other sort of injury which can occur, that is the injury to the lower roots of brachial plexus, that is the one which is going to involve the C8T1 fibers. So in this case, keep in mind this sort of injury is less common as compared to injury to the upper roots. And this sort of injury can be due to a stretch which is caused by the abducted arm being pulled excessively away from the body. And this can happen in a difficult vaginal delivery or a person falling from a height and clutching at an object to save themselves. Also, it can occur due to compression of a cervical rib or compression from a tumor in the neck or chest. The presentation is known as klumpke'spalsy, and typically the nerves affected are peripheral nerves which are derived from T1 root, and this would be the ulnar and the median nerves. Now, this is the characteristic deformity which occurs in klumpke'spalsy, known as the claw hand deformity. The forearm and intrinsic hand muscles, they are the ones which are paralyzed, leading to this position, which is this deformity of the hand, which is known as the claw hand. And you can see over here that in this condition, there is a flexed interphalangeal joints and extended metacarpophalangeal joint in this claw hand deformity. There's also a sensory loss which occurs in the medial side of the arm, forearm, the hand, and the medial two fingers. Now let's see the pathophysiology of these presentations. The clawed hand occurs because nerve fibers of T1 run within ulnar and median nerves, which are supplying the lumbrical muscles of the hand that normally have the function of flexing metacarpophalangeal joints and extending interphalangeal joints. So since this action is going to be lost, then the opposing muscles will produce the deformity of the claw hand. Now that we've discussed the applied aspect also brachial plexus, we are going to now apply that knowledge in solving a few MCQs related to this topic. So here is the first MCQ, and that is the 12-year-old boy is diagnosed with an upper brachial plexus injury after falling from a tree. He presents with right upper arm at his side due to loss of abduction. Which of the following muscles are primarily responsible for abduction of the arm at the shoulder? So I just told you that the abductors are the deltoid and supraspinatus, which are supplied, deltoid is supplied by the axillary nerve and supraspinatus by suprascapular nerve. This B will be the correct answer to this MCQ. A 22-year-old man is brought to the emergency department with a knife injury to the axilla. The physician suspects injury to the lower brachial plexus. Which of the following nerves is most likely to be affected? Now we're talking about lower brachial plexus, so the ulnar nerve, which is supplied by the root C8 and T1. This is the one which will be affected. Answer is E for this MCQ. The peripheral nerve arising directly from the upper trunk of brachial plexus. Upper trunk of brachial plexus, that gives rise to the suprascapular nerve. We just saw that when we were talking about the minor branches of the brachial plexus. Which of the following nerves is a branch of the lateral cord of the brachial plexus? Lateral cord of brachial plexus gives rise to musculocutaneous nerve, so that is actually the continuation itself of the lateral cord of the brachial plexus. We know that, we just talked about it. Which is the smallest branch of the medial cord of brachial plexus? Now the smallest one is the medial cutaneous nerve of the arm, since it's going to end in the arm close to its place of origin. So this concludes with today's revision of the brachial plexus. I hope you found it helpful. I hope you found the mnemonics helpful. And this is a very important topic, keep in mind. And if you have the brachial plexus like on your fingertips, if you can draw the brachial plexus in less than 2 minutes, then you can never forget the major branches and the parts of the brachial plexus. So also keep in mind the mnemonics. They're always going to help you remember. This is something which is the, like I told you in the part and in the start of the presentation, it is the keystone of the upper limb anatomy. And if you understand the brachial plexus, if you've memorized it very well, if you keep revising it again and again, then you can always apply that knowledge in answering any sort of MCQs, in diagnosing the problems which are related to nerve injuries. So you've got to keep in mind the basic anatomy, the parts, the branches of the brachial plexus. It should be there on your fingertips. So if you found today's topic helpful, today's revision helpful, don't forget to like and subscribe to my YouTube channel, AnatomyMentor, and also hit that bell icon for further notifications whenever I upload a video. And stay smart, enjoy your studies, and I'll be back with new topics, especially from gross anatomy. Thank you. Take care. Goodbye.